February is National Heart Awareness Month, and for this special edition of Medwatch today, we talk about how to protect your heart and talk with your doctor about the risk factors you should know. Hi, Dr. Bong. Thank you so much for being with us today. We really appreciate your time. We know that February is National Heart Awareness Month, and we really want viewers to have a better understanding about how to have those conversations about their heart health with their primary care doctor. What is the best approach in terms of talking about your heart health?
Well, it's good to address with their primary risk factors for heart disease. Some things that can cause increased chance of heart disease include high cholesterol, diabetes, high blood pressure. We just want to make sure that those risk factors are well controlled and that people are optimized on the right drugs, and if maybe they can incorporate some lifestyle changes that could also help with that.
And what would you say, how important is it for family history as well?
Yeah, family history is very important because we take that into high consideration because that genetic loading that gets passed on from generation to generation does affect someone's risk factors. Maybe some families with family history of high cholesterol, that becomes a risk factor for heart disease, and so it's good to know who you come from and what they have, so that then you can also be proactive and tell your primary or your cardiologist that, hey, I think I need to be doing, I need to be eating more plant-based diet.
And what risk factors would you also say are important to consider when it comes to heart disease?
Yeah, some really easy ones to risk factors to avoid are things that are kind of self-induced, so some habits that we all can sometimes develop, such as excessive drinking of alcohol, sometimes smoking or vaping, sometimes living a sedentary lifestyle. I find myself guilty of this as well, maybe eating out a little bit too much and consuming processed foods.
If someone is watching and maybe they're a little bit concerned about their heart health, what would be one major piece of advice you would give them?
Yeah, so for folks who are really interested in helping prevent heart disease and interested in making sure that their heart health is really, really good, is avoiding those risk factors, like I said before, but avoiding smoking, vaping, any sort of drug use, cutting back on processed foods, increasing their activity level. Anything kind of helps, but also reaching out to their primary, making sure that the primary, who is kind of the leader, the one who's steering the boat in their health, and just consulting them on their advice, and really just checking in with them more frequently.
It sounds like lifestyle is a major factor to a healthy heart.
Yes,
Yeah.
it's a huge factor.
Huge factor. All right, Dr. Bong, well, thank you so much. We really appreciate your time.